Hi everyone, we are doing meningococcal meningitis, and my name is Olivia.
And my name is Mireya. So I'll be saying the name of the pathogens, which is Neisseria meningitis, Streptococcus pneumoniae, and Haemophilus influenzae. These are the main pathogens of this disease. And in here, I put some examples of the morphology of the gram, which are disease. It's a gram-negative Diplococcus bacteria. And the first one is a Neisseria meningitis. The second one is a Streptococcus pneumoniae, and then the third one is showing a Haemophilus influenzae. And then now for the mode of transmission. So this disease is spread through close contact with an infected person's respiratory droplets, such as when they cough or sneeze, kissing, sharing a drink, and living in close quarters. This disease is not a highly contagious disease, and it's not easily spread by sharing food, drinks, or cigarettes, but saliva can inhibit the growth of the bacteria. Some ways to reduce the risk of spreading this disease is by cleaning and disinfecting frequently touched surfaces and maintaining good indoor ventilation. Also, by avoiding crowded or poorly ventilated public places, or even by wearing a surgical mask. And then some of the major signs and symptoms of this disease is like high fever, headache, stiff neck, nausea, vomiting, rash, or even changes in behavior. And by changes in behavior, what it means is that it could make you like really sleepy or like it's really hard to wake up. It even gives you like joint or muscle pain and even no appetite or thirst and even seizures.
Okay, so I will discuss about how the bacteria do damage. So when the certain pathogen, like Neisseria, gets into the brain, it will find itself in the cerebral spinal fluid. And once they're in there, the bacteria is able to multiply quickly. And then, because it's an endotoxin, when the bacteria itself lyses and dies, it releases the LOS toxin, which can cause inflammation and swelling in the meninges part of the brain. And when inflammation and swelling of the brain can result, all those different symptoms that Maria mentioned will happen. So, headache, sick neck, irritant of bright lights, confusion, drowsiness, delirium, and seizures. The mortality rate for meningococcal meningitis is kind of high due to how unlikely it's really able to occur. So it can between 10 and 15% mortality rate. In 2023, there was a slight increase in mortality up to 18%, and one in every 20 people who actually contract meningococcal meningitis will die. So the distribution of the bacteria. So the bacteria Neisseria meningitidis is actually found in the back of the nose and the throat. And one in every 10 people actually live with this bacteria, but they don't get sick because it's where it's supposed to be in that area of the body, in the back of the nose and the throat. However, it can turn into an opportunistic pathogen, and so once it leaves that area in the nose and the throat, it can find itself in the meninges part of the brain, and that is when it causes the infection. So treatment and prevention, if you or you know someone who you're close with who you think might have meningitis, really a quick treatment and diagnosis is the best chance of good recovery. Um, Whoever needs treatment has to be treated in a hospital setting and they receive medication. Usually they'll get steroids, antibiotics, and sometimes when people are actually admitted to the hospital, they need oxygen as well. And someone who has this bacterial infection can be in the hospital anywhere from 5 to 7 days. However, if they're recovering quickly or at a good rate, they can sometimes be just discharged sooner. Additionally, if you do end up taking someone to the hospital with meningococcal meningitis, you yourself will have to probably be given some type of antibiotic since you'll have been in close quarters with that person. The prevention of getting this bacterial infection is vaccination. There's three different types of vaccinations since there's different strains of meningitis. The three different kinds are the meningococcal conjugate, the serogroup B meningococcal, and the pentavalent. The ages that they recommend for this type of vaccination is pretty much when you're a teenager. They start to recommend that they receive different vaccines based on the strains that are probably more prevalent at this time. So, well, the interesting finding that I found was that you can do a self-check at home if you are concerned that you think you might have meningococcal meningitis. So what you do is you try to touch your chin to your I suppose say your chest. So if you can touch your chin to your chest, then you're good. And if it's impossible for you to do so, then you might want to go get checked out because that's because one of the symptoms of having a sick neck will prevent you from being able to do that.
And then what I found is that this disease, the meningococcal meningitis, it's a rare disease. And it also stated that 1 out of the 7, 10, 14% of those who get the disease, they die eventually.
And that's it.
Thank you.